Hola y muy buenos días a todos. Gracias
Good
por...
morning to all of you. Thank you for connecting to this weekly press briefing by PAHO here on the COVID-19 pandemic in the Americas. My name is Sebastián Oliel with the Communications Department at PAHO, and let me remind you that this session will last between 45 minutes and an hour, and we will be accepting questions up to the very end. We have already received your questions via email, and also you will be able to ask new questions through the chat and the Q&A button. Please do include your name and media outlet when asking your questions. Please bear in mind that we do have interpretation into English and Spanish, and you can just click the button that reads interpretation. Today, the director, Dr. Carissa Etienne, will be reporting on the current situation of COVID-19 in the region, the threat of the pandemic to the control and also the elimination of other infectious diseases, as well as the excess mortality that we are seeing, not only because of COVID, but also because of the impact on our health services. We have here with us Dr. Jarbas Barbosa, Assistant Director, Dr. Ciro Ugarte, Director of the Health Emergencies Department with PAHO, Dr. Marcos Espinal, Director of the Department of Communicable Diseases here at PAHO, and Dr. Silvan Aldiguieri, Deputy Director for Health Emergencies at PAHO and also Incident Manager for COVID-19. So now I would like to ask Dr. Etienne to take the floor with her opening remarks.
A very good morning to all of you, and thank you for joining today's briefing. As of August 10th, there have been more than 10.5 million cases and over 390,000 COVID-19 deaths reported in our region, with the United States of America reporting around 5 million cases and Brazil reporting more than 100,000 deaths. Every day, we're seeing more than 100,000 new cases being reported in the Americas, over half of which are coming from the United States. But we are also seeing worrisome spikes in places that had managed to contain the epidemics previously, like Colombia and Argentina. We are also observing an expansion of cases in Central America, where this week, Belize reported its highest ever number of new COVID-19 cases. And in the Caribbean, the Dominican Republic is reporting more cases than all the other island nations combined. These numbers make it clear that our region remains under the grip of COVID-19. But the virus isn't the only threat to people's health. The pandemic is also disrupting our ability to control transmission of other infectious diseases, many of which we have been fighting to eliminate for decades. The Americas has always been at the forefront of the elimination of infectious diseases. Indeed, preventing and treating these diseases was the impetus for creating the Pan American Health Organization nearly 120 years ago. We know that in some countries, infectious diseases such as dengue and malaria place a huge burden on health services. And along with many neglected tropical diseases, they have a disproportionate impact on poor and vulnerable populations, including our indigenous communities, much like COVID-19. In October last year, PAHO's member states committed to a region-wide approach for the elimination of more than 30 communicable diseases and related conditions in the Americas by 2030. The progress to achieving this milestone is now under threat due to the burden of COVID-19 on health systems and the disruption of essential services, including priority disease control programs, elimination initiatives, and routine immunization. Services for common conditions like TB, HIV, and hepatitis are being affected. Over 80% of the countries in Latin America and the Caribbean are reporting challenges in the delivery of TB tuberculosis treatment. If patients skip doses or interrupt their treatment, a manageable condition can quickly turn into an active infection that threatens not only the patient, but also their family and close acquaintances. HIV is an example of a virus that we know how to prevent and to treat. In fact, several countries in our region have successfully eliminated HIV transmission from mothers to their newborns, which is a major example of the commitment of our countries. But we have data indicating that 30% of people living with HIV are avoiding seeking care during the pandemic. And at the same time, countries have limited supplies of antiretrovirals. This is worrisome indeed, since without continued care and consistent medications, people living with HIV are more likely to become ill and to pass on HIV to their partners. 1/3 of countries in Latin America are also experiencing disruptions in hepatitis screenings that are key for early detection and treatment. I want to talk a little about mosquito-borne diseases. Diseases spread by mosquitoes are widespread in our region. And since our collective ability to monitor viruses and pathogens has also been impacted by the pandemic, we are also concerned about falling behind on these diseases. In the first 2 months of 2020, for instance, the Americas reported a 139% increase in dengue cases when compared to the same period in 2019. However, since COVID-19 hit our region in March, reported cases of dengue fever have actually fallen. We've also seen that reporting of mosquito-borne diseases like malaria is down more than 40%. And there has been also an observed reduction in the number of people getting tested. So we know that this data really do not tell the full story. Without robust surveillance, we remain unaware of the extent to which these diseases are affecting our population and are therefore unable to sufficiently plan services and save lives. Really, for diseases that are completely curable, this is not acceptable. While it is true that because many of us are stuck at home, we are therefore less prone to getting bitten by mosquitoes, the reality is that mosquitoes and the pathogens that they transmit are still circulating. And without testing or treatment, severe cases of mosquito-borne diseases could go from easily treatable conditions to death. And in fact, we are beginning to see just that across our region, and indeed the world, that people are dying at higher rates than normal, not just from COVID-19 itself, but because of the impact of this pandemic on essential health services. Beyond disruptions to treatment, prevention and control programs are being paused or halted during the pandemic. These programs normally provide people with the tools, the services, and the information that they need to protect themselves from infections like HIV, TB, malaria, neglected tropical diseases, and vaccine-preventable diseases. And just as we were making significant progress against neglected tropical diseases like lymphatic filariasis, schistosomiasis, and soil-transmitted helminthiasis, the pandemic interrupted the mass drug administration campaigns that are so vital to our elimination efforts. Ultimately, these disruptions are likely to drive infection rates up in the coming months. In the short term, this means that more people will die from preventable and treatable conditions. And in the long term, the progress that we've made in recent decades could be lost in a few months. If these difficulties continue, we may even have to revisit the elimination targets for some of these diseases. But the good news is it's not too late to prevent these outcomes. If countries take key steps to track and limit the impact of infectious diseases during the pandemic, we can continue with impact. As I've said before, countries need to strike a balance between confronting the threat of COVID-19 on one hand and maintaining essential services on the other, including those that help manage and prevent infectious diseases. Across the Americas, local clinics, urban hospitals, and regional laboratories collect data about who is sick and the cause of their illness. They also survey the environment to detect how viruses and bacteria are spreading. So a handful of cases does not lead to larger outbreaks. We have a responsibility to ensure that our disease surveillance networks continue to function, especially during the pandemic. Health systems must also make it easier, not harder, for patients to receive the care that they need during this unprecedented time. Leveraging telemedicine and offering care outside of hospital settings, such as through community outreach programs and at-home visits, will be key to ensuring that patients can continue to receive the medical attention and the medications that they need to safely manage their conditions. As countries work to provide essential services and to resume prevention programs, they must be careful to also protect our health workers who are on the front lines of this pandemic. Our doctors, nurses, and staff must have the protective equipment, the supplies and technologies that they need to safely offer and deliver care. All of these changes require that countries commit to strengthening their health systems and invest in the health of their populations. While the challenge may be daunting, the pandemic has shown us that our health is a prerequisite to the well-being of our societies, and I dare say the success of our economies. Countries cannot delay the fight against COVID-19, but we must not let COVID-19 delay us in completing our unfinished agenda of eliminating and controlling infectious diseases in our region. The risks, I believe, are just too high, both for our lives and for our societies. Over to you, Sebastian.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. Now we are going to have the question and answer session. We have already received questions via email, and we will be reviewing also the questions sent via the Q&A button. And we are also going to ask you to identify with your name and also the media outlet that you represent. The first question has to do with the remarks by Director Etienne.
The region's achievements in HIV and TB, among others, including treatment coverage for HIV. Dr. Etienne.
So thank you for this question. We know that COVID-19 is having a huge effect on countries' abilities to respond to other health crises. And this is why it is so critical and of high importance that countries really fight to protect the hard-won gains that we've made. The availability of HIV and TB medicines has indeed been impacted, as we discussed earlier. But we are seeing measures being implemented to address this, including emergency procurement via the PAHO Strategic Fund. We are seeing exchange of medicines between countries and the optimization of treatment regimens. We are also beginning to see anecdotal evidence of a reduction in detection of new cases of HIV and increasingly late diagnosis and a drop in patients who are seeking and continuing treatment. Some countries are addressing these issues by providing patients with increased supplies of medicines so they don't have to return so frequently and through telemedicine. But we also need to introduce new measures, such as self-testing, which we know is an important tool that many in our region are not yet aware of. For TB, 80% of countries in the region are already changing the way that services are being delivered. So while greater efforts are needed, we know that all is not lost. Our countries are responding and beginning to respond. And finally, while some models are indeed predicting significant increases in HIV and TB mortality across countries that have been impacted by COVID-19, this is not yet a certainty. Countries must now ensure that innovative, integrated HIV and TB services are expanded and strengthened across the board to facilitate testing, treatment, and continuation of treatment. And we really must protect these decades of hard work for HIV, TB, and many other communicable diseases. We have to protect them from the overwhelming impact of COVID-19. And our countries are beginning to respond. Over.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. The next question is by Angeline Montoya from Le Monde via email, and she's also connected, and she says, can we observe that the curve has flattened in some countries such as Chile, Ecuador, and Bolivia? In Latin America, Dr. Barbosa, could you please address this question? Thank you very much for the question, Angeline. The situation in the three countries that you mentioned is a little bit different. In Bolivia, unfortunately, if you see, we have had an important spike in cases over the last couple of weeks, and in some areas such as La Paz, that are areas with high density of population. In Ecuador and Chile, we see the flattening of the curve, but a high level of transmission. This population, we see this in the population because in some cases, for example, in some areas of the country, the situation maintains. So when you look at the average, it does look like a plateau, but this situation does not reflect a flattening of the curve, but the control of the situation. So they need to continue to implement the social distancing measures and also to enhance testing, PCR tests, and also data monitoring, all of the measures that are efficient to reduce transmission. Thank you.
Gracias, doctor.
Thank you very much. The next question is by Cynthia Rojas Toro. She's saying that Paraná was one of the areas that implemented the most rigorous lockdown but in quarantine, but we do have high levels of transmission on a daily basis. What are the conclusions that we can reach and whether the zero prevalence studies may help and how? Dr. Espinal. Thank you very much for this question. Here we see the how it is impossible to forecast what is going to happen with this virus. We do not have an answer. We do not have a calendar year. We do not have any certainties as to what the communication rate is among people without symptoms. Some studies suggest even a 40% transmission in asymptomatic individuals. There are a lot of questions that need to be answered still, and that is a reflection of that situation. We cannot lose hope. The non-pharmaceutical measures such as social distancing, also wearing masks and washing hands do have an impact clearly, but the dynamics in Latin America and in countries such as Panama is different from European countries. We have inequalities. We also have high informal economies and also populations that are living in vulnerable conditions. And we do need to take this into account. We should not lose hope. We need to continue to implement the measures, and the reopening should be done carefully, also taking into account at all times the social, economic, and health aspects. The zero prevalence surveys do help, but we do need to take into account that they are going to determine, they're not going to determine the virus. That has to do, it has to do with the antibodies, and that shows that people have already had the infection, but many of these antibody tests have not been very efficient. Some others are now being more efficient, but whenever a country decides to introduce this type of survey, they do need to consult with PAHO as to the test to be used, because oftentimes these tests are not highly sensitive and they do not have the specificity that they need to be able to determine the scope of the problem. They will help to understand the situation, but they are not going to tell us much about diagnosis. So we do need to take that into account. We do need to continue with PCR and non-pharmaceutical measures. Thank you, Dr. Espinal. The next question we have is by Julissa Alvarez from El Libre in the Dominican Republic. She's saying that in some countries in Latin America, the convalescent plasma is being used for treatment of COVID-19 patients. Could you please refer to the use of plasma in terms of efficacy and among other issues? Dr. Aldiguieri, could you please address this question? Yes, thank you very much for this question. The use of convalescent plasma is a well-known and standardized methodology for some viruses in our area. The best example is the Junin virus from Argentina, the hemorrhagic fever, and that has been used for diseases such as, for example, the Ebola virus in Africa. The word convalescent plasma covers several products from whole plasma to monoclonal or polyclonal antibodies, but this is not part of the standard treatment against COVID-19 as we recommended at this point in time. It is an option that is being researched, and as of today, there is no clear evidence to conclude on the benefits or the risks. We are just investigating this issue, and also the efficacy is being researched through various randomized trials. So it is important to mention that the technical guidelines as to the regulation for those randomized clinical tests is on our website. You can find that information, and that the information group that is working on COVID is also ready to offer any help in this area. Thank you. Thank you, Dr. Aldigueri. The next question is by Alejandro Esquiste from Guatemala. He's also connected, and he's saying that Guatemala, as of July 18th, changed the way they manage the numbers of the pandemic, and they have now been using the 21-day method that entails declaring a COVID-19 patient as recovered if after 21 days the person has not died and no other test is being done to make sure that the person is no longer positive. Alejandro is asking whether this is a method that is being supported by PAHO, by WHO, and also the criteria used for its approval, and whether this method is being used in other countries. Dr. Ugarte, could you please address this question? Thank you very much, Alejandro, for that question. The surveillance guideline used by the Ministry of Health was updated on July 8th, and a recovered case is a confirmed case that meets certain parameters for symptomatic, asymptomatic cases, and also for confirmed cases that did not have any follow-up by the health services. So to record any information as to the condition of those confirmed cases, in particular, those that are being recovered, those that are recovering at home without going to health care services is very difficult. So Guatemala has decided to have an estimate of the number of people that have actually recovered. They have analyzed all of the confirmed cases, and they determined that they will consider recovered all of those cases that have been recorded in the database after at least 21 days of the first sample. We should also take into account that based on clinical criteria, full recovery of patients may be quite long. But in most countries, the recovery criteria is that a subsequent test is negative. So we do know that there is an impact on health, not only on physical, but also on the mental health of persons. And this takes months. This takes very long. So the term recovered means to the acute phase of the disease. And in that sense, most of the countries, based on the clinical guidelines published by WHO, most of the countries are incorporating this criteria to consider that these patients are now recovered. The most important aspect is detection, isolation of confirmed cases, and also suspected cases, and also to quarantine contacts, as well as introducing individual measures at all times. The information on recovered patients is information that we will analyze in the future under very strict guidelines, but countries do need to have information, and Guatemala has adopted that decision based on WHO guidelines. Thank you very much.
Thank you very much, Doctor. We will now go to questions that we're getting over the chat. We're getting several questions that have to do with the vaccine, so let us attempt to do this in parts. Valeria, a journalist from El Comercio newspaper, says that Russia states that they already have the new vaccine against COVID-19. WHO, PAHO, have you negotiated any purchase, any procurement of these vaccines with Russia through the COVAX mechanism? And if that is the case, how advanced are you in these agreements in order to have access to this vaccine, and what progress is being made with the other vaccines? Also, Claudia Luna Palenco from Vertigo Politico TV Azteca on the chat is asking a similar question to that of Valeria, but she's asking whether the revolving fund of PAHO will also negotiate this vaccine with Russia. And Catalina with Health Lupa Connected wants to know about the work that is being done by PAHO in order to guarantee access to these possible vaccines. Dr. Barbosa, could we start with these questions? Yes, thank you. There is interest in having a vaccine against COVID-19. And we heard the news about Russia that they already have a vaccine. In principle, a vaccine or the manufacturer of the vaccine must undergo clinical trials at phase 1, 2, and 3. And this is standardized all over the world. And you cannot use a vaccine or drugs or medicines without following through all these stages, having complied with all these stages. So after completing the phase 1, 2, and 3 clinical trials, the manufacturer requests the authorization from the regulatory authority in that country, as well as in other countries where they want to market the vaccine. The regulatory authority analyzes the record, the registration of the vaccine, assesses the quality of the manufacturer until they go through all the data, reviewing the data of all clinical trials. This is a guarantee that assures us that this is an effective, efficient, and safe vaccine. So currently, WHO is in contact with the regulatory authorities in Russia in order to receive information on this vaccine. And only after analyzing all of the information, making it possible for WHO to make a recommendation for a vaccine to be recommended by WHO, and for this to be procured or purchased through the revolving fund on vaccines of PAHO, that vaccine must be pre-qualified by WHO. And in order to pre-qualify, they have to undergo this entire review on how safe it is and the quality of the vaccine. And the same thing, you have to follow processes by the health authority in the country in order to have a quicker assessment, but with a full guarantee that it is safe, secure, effective, and efficient for any vaccine that will be used. So only after this review, after having access in a transparent way to all the data, to all the information, that is when the WHO will take a position, and then WHO will be able to give us an assessment of this and any other vaccine. The process is exactly the same. Thank you. Thank you, Dr. Barbosa. We have a couple of questions on follow-up. Anthony Broadley from Reuters News on the chat is asking, they say that the state of Paraná in Brazil is holding talks with Russia in order to produce a vaccine against COVID-19. And they're asking whether Brazil should be concerned or worried about producing a vaccine that has not as yet completed phase 3 of these tests and trials. And also Uriel Velasquez from Nicaragua is saying that Nicaragua has confirmed that they will acquire the Russian vaccine and that they're negotiating the production of the vaccine in Managua. And he's asking whether PAHO sees the production of the vaccine as something reliable, producing the vaccine in Managua. Dr. Barbosa, could you also answer these questions? Thank you. Yes, I believe that it is very important to see this effort that is being made by countries in the region in order to attempt to increase the production capacity for future vaccines against COVID-19. But once again, any vaccine by any manufacturer must follow this methodology that is used throughout the world. They have to conduct phase 1, 2, 3 clinical trials in order to make sure that the vaccine is safe and effective, and to request that the vaccine be registered by health authorities in the country, and also to have the recommendation of WHO. And if you want that, and for PAHO to be able to acquire this vaccine through the revolving fund, the vaccine must be pre-qualified by WHO. So on this, we're waiting for information on the Russian vaccine. It is impossible to perform an assessment or give an opinion on this. We're holding dialogues and conversation with the Russian authority in order to review all data. And only after that review will it be possible to say whether the vaccine complies with all the requirements, whether it is safe, effective, efficient, and it proves the value of its effectiveness. There's no 100% effective vaccines, not at all. All vaccines must prove, they must show that besides being safe and effective, they must prove that they can provide protection to the people that receive them. There's a whole process of a technical review that must be followed very carefully in order to make sure that the product is safe and effective for the population. Thank you, Doctor. The next question on the chat comes from Tanya Smith Cartwright, the Tribune newspaper in Bahamas. And the question is,
worked in terms of flattening the curve of the second wave, or what do you recommend now that our cases are rising again? And also, what do you think about our second wave of cases? Is it due to more testing or what? Doctor Alighieri podría contestar esta pregunta.
Thank you.
Dr. Alighieri, please.
From the Bahamas. In the Bahamas, around 215 new cases were reported in August during the last 10 days. The lockdown, which was already effective in Grand Bahama, has been extended to all Iceland. And the common sense says we have, I think, to wait a little bit before making conclusions regarding the implementations of these very strong public health measures. We cannot say that the increase in number of cases is due to the increase of testing. We would favor more the relationships with the resuming of non-essential travels, and including with countries that are have very high rate of transmission at the moment. The Bahamas from the month of February has the PCR capacity established, and we are working very closely with the Bahamas regarding the strengthening and the expansion of the laboratory surveillance network. I'd like to flag the importance of the strengthening of the contact tracing activities, and to highlight the implementation in the Bahamas at the moment, during the months of August, of a contact tracing strike force, and which is a very important tool for controlling this increase of cases reported through the international health regulations during the last 10 days. Thank you.
Muchas gracias, doctor. La siguiente pregunta tenemos.
Thank you very much, Doctor. Next question, we have two from Nicaragua. It comes from Livia Lopez from La Prensa, and also Uriel Velázquez from Despacho 505, Nicaragua. Lydia says that recent reports from the Ministry of Health show a decrease in the number of cases in Nicaragua. So the question is, how are we to interpret the situation when the government has not taken any prevention and containment measures for the virus? And she also says that the airport in Nicaragua reactivated its operations, and they're collecting a charge for applying tests on travelers in order to detect COVID-19. What is the main measure that should be used by the government in connection with this? And connected to this last question, Uriel Velázquez also wants to know how many tests, COVID-19 tests, have been donated by PAHO to Nicaragua, and how has each government decided to charge for these tests? Dr. Ugarte, could you please answer these questions? Thank you. The COVID-19 pandemic sees an increase and a decrease in the number of cases. And this in countries where we have detailed information. daily detailed information, and there's a specific follow-up on how the cases are behaving. As we said previously, in the case of Nicaragua, it is not possible to perform such an analysis, but it is useful in order to be able to communicate to the population in general that under those conditions, it is necessary to take all necessary measures at all times. And I believe that the director has highlighted these, and each one of my colleagues, in order to provide individual protection to protect the entire population. And this is especially important and should be carried out when we do not have sufficient information and following an adequate routine in connection with how much to be charged for these tests. PAHO believes that based on the principles of universal access to health and equality for those people that don't have resources, and particularly in a pandemic such as COVID-19, these tests should not entail a cost for the population. PAHO, as I can tell you, has donated more than 1.5 million personal protection equipment and other inputs and other supplies, for 250,000 molecular reactions for the case of COVID-19. So in connection with those aspects, I would say that access, unlimited access, unrestricted access from the point of view of the population in order to take the test, particularly when these are contact cases, contact tracing cases, or suspected cases, this allows decision makers to know how the pandemic is behaving and to implement and enforce adequate decisions in order to control the pandemic. If we apply a cost on these tests, obviously people without resources will not be able to take the test. And it limits the possibility in order to have information on how the pandemic is behaving. So we're working in the dark. On the other hand, I want to highlight the aspects that have to do with travel, because this has to do with travel. There's not one single test that allows us to limit the incoming entrance of travelers to a plane. And this is very important. And the guidelines established by WHO in relation to travel is a very important issue because it enables us to take things in context in general. When international travel and even domestic travel is being reopened, reactivated, and we need to take into account several aspects, including individual responsibility and liability when you have to travel. So this is an important issue to be considered in this context. Thank you. Thank you, Doctor. Next question on the chat comes from Valeria Roman in Pobay, Argentina, and it says, do you believe that public campaigns in the media and social networks should be improved in countries in Latin America so that people will comply with the recommendations of using masks, social distancing, and staying at home, amongst others? Dr. Espinal, could you answer this question? Thank you very much for the question. Very important. The first thing we have to say is that there's always room for improvement. And education campaigns, information campaigns for the population are extremely important because they keep not only the population at large informed, but also the different groups in society. We cannot fight against a pandemic such as this one if the different strata of the population are not duly informed. Besides, information is power. Information enables us to empower our societies so that they will be able to demand from their decision makers the care that is needed. So it's important to take into account that we must not neglect efforts in advertising campaigns, in social media. There has been a lot of misinformation and bad information, but we've also had very good information. And the role of communicators here is very important. They're a good ally of good communication, and I congratulate our communicators for the work they do in order to keep the public informed in our countries. It is important to maintain these campaigns and that we can continue improving the campaigns. And for this, we have experts, technical teams, experts in communication that can provide advice to our countries, in our country offices, and in our headquarters. Thank you. Thank you very much, Doctor. Next question on the chat comes from Alina Diaz de AFP. She says that some researchers have suggested that it is possible that other vaccines will increase immunity against COVID-19. What does PAHO have to say about this? And what progress do we have about the protection that would be provided by BCG vaccine against COVID-19? Dr. Barbosa, could you please take this question? Thank you for the question. This is a hypothesis that is being evaluated whether the BCG vaccine, which is used in many of the countries in Latin America to protect against TB during childhood and adolescent years. And if this vaccine could have some level of protection that could be provided to people who've taken this vaccine when they were born, and whether these people would be more protected than those that did not have the vaccine. We don't have any final data on this. There's some projects that are being studied, even some in Latin America. But by no means a person, just for the mere fact that they took the BCG vaccine, has to believe that they're protected against COVID-19. There's no evidence for that. We have to wait until they complete all studies. But unfortunately, we've had several significant outbreaks, and some of these outbreaks with dramatic impact in cities, provinces, states in the region where they use the BCG vaccine. So it's good to keep the data, but not to take this as if this were gospel truth and to believe that people who've had BCG vaccines are more protected. It is not in keeping with the information that we have so far. Thank you. Thank you, Doctor. Next question on the chat comes from Juan Manuel Nievas from the Shilshua Agency in Argentina. He says that in Argentina, 69% of cases, COVID cases, have recovered. And the question is, to what do you attribute that high level of recovery? What has Argentina done right ever since the outbreak begun? And where is there room for improvement? Dr. Alighieri, could you please take this question? Thank you for that question. The outbreak, the COVID-19 outbreak in Argentina started in Buenos Aires, including the city of Buenos Aires, and after that, the province of Buenos Aires. And most of the cases have been reported from that metropolitan area. What I'd like to highlight with the reports from Argentina is that 60% of the cases, accumulated cases, have been reported during the month of July. So in fact, this was done during the last 5 or 6 weeks. However, we have seen in the reports provided by the Health Ministry, we've seen a spread from the metropolitan area to the less populated areas in the country, as was the case recently with Jujuy in the northwestern part of the country. Now, on aspects that have to do with the share of cases and if there are any reports, what we know from scientific publications and global reports is that 80% of the cases are mild or moderate. 15% are severe cases, 5% are critical cases. In this context, the reports received from Argentina are consistent with figures published in scientific publications, scientific reports that are available. Now, regarding strong points, the strengths of the systems in the response, I always wish to highlight the importance and the need for having epidemiological surveillance, robust epidemiological surveillance that has been strengthened during the outbreak. This is key in order to monitor the situation, and Argentina is notifying through the international health regulations channel with all the accurate line listing, as we call it in English. And I also wish to stress the significant aspects in the expansion of the laboratory network throughout the national territory and the provinces, and interesting experiences in terms of contact tracing, including in areas where we have underprivileged and marginal populations. And these are aspects that have also been shared on South cooperation efforts in countries with Southern Africa, for example. In terms of challenges, I believe that Argentina is facing the same challenges that several other countries in the region have faced, having a mosaic of epidemiological profiles on the basis of geographic location or the unique segment of a population, and the challenge of ensuring a necessary balance between the necessary and strict implementation of public health measures with an aspect of reactivating economic aspects and trade exchanges. Thank you. Thank you, Doctor. The next question is from Gisela Salomon from Associated Press, and she says the following. Some countries in the region have already started to eliminate these measures to contain the pandemic, amongst these Venezuela, even though cases are rising. Has PAHO discussed this with Venezuela? What are the risks? And does this pose or offer any advantage? Dr. Ugarte, could you please answer this question? Yes, there is frequent contact with all the different government levels in Venezuela, the Ministry of Health, with the scientific authorities, and through the working group on health, with many other agencies that have to do with how the pandemic is doing in Venezuela. There's a concern regarding the time it takes to get the results from the test. So a positive or negative result can take 2 weeks, and in some cases, even longer. So in that regard, it is important to take into account the fact that the government and the governors and the way they see the path and the development of the pandemic in Venezuela are taking actions in limiting or expanding restrictions and movement of people. In that regard, this is a process that all countries face, the challenges of opening or not opening the economy or going back to a strict lockdown. And I believe that this is a measure that must be taken linked to the laboratory capacity in the country. And in this regard, all efforts are being made in order to decentralize the tests and to make sure that the epidemiological analysis will be performed in a better way. And thus, the resources that have been provided have a priority in the healthcare and the protection of the health of personnel, epidemiological surveillance, diagnosis, and then after providing some additional input for the recovery of critical services in Venezuela. The situation is not easy, but I believe that the only way of responding to an emergency such as this one, in the case of Venezuela in particular, is with the participation of all forces and all institutions. Thus, this is hard, difficult work, but there are a lot of people that have the objective of protecting the population, and we're working with them. Thank you. Thank you, Dr. Ugarte. The next question is from Milibi Arruda from the Estado de Sao Paulo newspaper in Brazil. She says the following.
Brazil was registering less new cases in the last 6 days, which might be a signal of improvement in the country's situation. What is PAHO's view on Brazil's situation now? The country reached the mark of 100,000 deaths caused by COVID-19. What actions recommended by WHO may Brazil be failing in apply? Dr. Espinal, ¿podría contestar esta pregunta?
Thank you very much for the question. I think we also said that Brazil could not stop implementing the mitigation measures and the non-pharmaceutical measures we recommended. It is important also to realize, because of the size of the country, not every state or municipality is the same. We're still seeing high number of cases and mortality reported from Sao Paulo, from Minas Gerais, and other states. Brazil still has a high rate of positivity in some states more than 20%, in others less, of course. But it is critical to continue implementing those, because somewhat the curve appears to be flattened. And in fact, in the last 2-3 days, the reporting has been about 25,000 cases, 22,000 cases, but that tells the inconsistency also of the reporting and the need to continue increasing the testing. Brazil indeed has increased the testing, but still there is a long way to go in making sure the test is widely accessible to the population. So the bottom line, I mean, we still need more time to conclude fully that the curve is going down. As the director said, some countries are reducing, but and Dr. Barbosa, but it's not yet curve that we can say is fully flattened or so. But encouraging results are always welcome, but let's not think that Brazil is yet out of the problem. Thank you.
Gracias, doctor. La siguiente pregunta viene de Melina
Thank you,
Ochoa.
doctor. The next question comes from Uno TV from Mexico. And the question is the following. There are perceptions from Washington University to the effect that there will be more than 150,000 deaths caused by coronavirus in Mexico by December 2020. PAHO, do you believe that this forecast is correct? And is Mexico to further reinforce a control strategy for the pandemic in order to avoid this forecast on deaths? Dr. Barbosa, could you please answer this question? Thank you. So the projections are forecasts that are done, and I believe that our challenge is not to let them become a reality. We need to assess correctly what is being done. We need to improve the response. And in the case of Mexico, for example, we must make an even greater effort in order to expand access to PCR tests. Without having testing accessible for all suspected cases, for contacts, contact tracing, and performing monitoring, it is very difficult to have this activity and control measures. So the Mexican government is making that effort, but we believe that it is important to expand furthermore the testing capacity. In Mexico, as in all countries in the region, there's monitoring per each state. There are states that have a very strong trend on the downward slope. They're reporting less deaths in Mexico, which is very important than what we've seen in recent weeks, which shows that it is necessary for the authorities to adequately review the measures that are being adopted and what to do in order to have most effective measures in order to reduce the speed of transmission in order to control the spread. PAHO is working with the Mexican government as well as with the other governments in the region precisely to provide that technical cooperation and to attempt to improve the response. The challenge is not to see this projection materialize. It is preventing from this to take place. And this is an appeal that we launched to all governments in the region. Thank you.
Thank you very much. We are getting to the end of this press briefing, and now the last question is the following.
Young people in spreading COVID-19. Dr. Etienne.
So thank you for this wonderful question. Let me start by recognizing that this week we are celebrating International Youth Day. And so I want to start by recognizing young people's voices, their actions, and initiatives in reducing the spread of COVID-19. Indeed, it is important to note that young people are not immune to COVID-19. Young people, do not have special powers against COVID-19. They are also at risk for severe sickness, hospitalization, and even death. As of July, we have recorded more than 200,000 confirmed and probable COVID-19 infections in adolescents in our region, and more than 10,000 hospitalizations and more than 200 deaths. So not only can young people contract the virus, but even when asymptomatic, they can spread COVID-19 to family members and friends who may be more vulnerable. We recognize that youth and adolescents throughout the region are disproportionately affected by a whole range of health issues like violence and suicides and road traffic accidents and substance abuse. Taking care of the mental health of young people during the pandemic is critical, particularly in a region where suicide is the third leading cause of death among adolescents and youth after homicides and traffic fatalities. So let's be clear. Suicide is preventable. COVID-19 is also preventable too. We recognize that young people are affected by the pandemic in a unique way, and they struggle and are impacted differently by prevention measures such as physical distancing and school closures. But we are living in extraordinary circumstances, and no more than ever, we need all hands on deck to get through what is this difficult time in our history. We need the energy and the innovation of young people to help us all through these challenging times. So to our young people, let me say that at PAHO, we want to encourage you to become engaged in your own health and that of those around you. Any engagement, be it small or large, helps us beat COVID-19. So follow prevention measures like regular hand washing and physical distancing. Assist or aid a family member or neighbor, and support community actions to help ensure that those who are struggling around you have the support that they need. You are a tremendous force for change. Many young people are already doing these things and more. And through this medium, I want to thank all of you for your commitment. Young people are not only the future, they are the present and an integral part of overcoming COVID-19. So go, young people. And thanks again for joining us for this media briefing. And we look forward to seeing you next week. Over. Thank you.
Muchas gracias, doctora Etienne, y muchas gracias.
Thank you very much, Dr. Etienne. Thank you all for connecting and participating in this session. As usual, we will be sending you briefly the opening remarks by Director Etienne, as well as the recording for this session. And please remember that you can find further information on PAHO's website, and we will continue to be in contact via email. We will be answering questions briefly. So thank you all, and see you next